Informed consent stands for the rights of patients and is a key part of the clinical research process. In this video, we will review the process of obtaining informed consent and how to inform patients about being a clinical trial subject. Informed consent is the process through which researchers provide the necessary information to potential participants so that a knowledgeable decision can be made about whether the individuals wish to take part in a research study. It is an ongoing process that begins with initial recruitment of subjects and continues after the initial oral or written agreement form from an individual to participate in a research study. Upon getting familiar with all the information related to the clinical trial, the patient has the option to decide whether he or she wants to participate in a study. If they agreed to do so, an administrative procedure is completed and the patient becomes a clinical trial subject. Let's review the differences between being a patient and being a subject. As we mentioned, when a person volunteers to participate in a research trial, his or her status changes from patient to subject. A subject in a clinical trial is an individual who participates in a clinical trial either as a recipient of the investigation of products or as a control. The subjects may not be receiving standard of care as patients do. The risks related with the treatment may be higher. Documentation for subjects is more extensive than regular clinical documentation. Finally, the subject is the ultimate decision maker and must have complete information to assure his participation remains voluntary. In general, there are 5 steps in obtaining an informed consent. Step 1 of the process is introduction. The investigator must introduce himself or herself to the potential subject and the proposed study. Step 2, an explanation. The investigator must explain the study to the potential subject, providing all pertinent information such as purpose, procedures, risks, benefits, alternatives to participation, and etc. Step 3, comprehension. The potential subject may be provided with a study information sheet and must be afforded sufficient time to consider whether or not to participate in the research. Step 4, question and answer session. After allowing the potential subject time to read the study information sheet, the investigator must answer any additional questions the potential subject may have and may obtain verbal agreement to participate in the research. And Step 5, obtaining consent. The following video will demonstrate how an informed consent can be taken.
Is it Mrs. Aline?
Yes.
Hi, I'm Katie. I'm one of the orthopaedic team. Is it okay if I talk to you about your injury?
Yeah, not a problem.
Okay, great. So I understand you've broken your leg. How did you do it?
I was out roller skating with my sister actually, and she just crashed into the back of me and sort of took me out, and I fell quite badly on my leg.
Oh goodness, okay. Well, I'm sorry you're in this position. Has anyone actually come to speak to you about this yet, or the treatment options that are available?
No, not yet.
No, okay. So you've broken your bone. The break is actually quite low down in your leg, near the ankle joint. Sometimes when bones break, we can hold those together with a plaster cast. But in your instance, where the bones have moved apart, you'll need surgery, unfortunately, to put those bones back together.
Okay.
Now, there are 2 different treatment options available, a nail or a screw and plate fixation. The nail will be inserted down the middle of your bone to hold the bones together, and with a screw and plate fixation, the plate would be put alongside the bone and used to put the bones back together. So both treatment options are good treatment options, and both are used routinely throughout the UK by surgeons fixing this type of injury. However, we don't actually know which treatment option, if either, is better for the patient in terms of pain and function in the long term.
Okay.
So we're actually running a study in this hospital to hopefully answer that question. So we've got some information about the study. Would you be happy to read it?
Yeah, no, that'd be fine.
So here's the information. So it's quite a lot of information to read, so I'll leave you for a few minutes and then I'll come back and see if you've got any questions. Is that okay?
Yeah, that'd be all right.
Great. Okay, so how did you get on?
All right, actually, yeah, it's quite a lot of information to take in.
Yeah, okay, yeah, no, I appreciate you probably weren't expecting to be in this situation either. So have you got any questions for me?
Yeah, actually, from reading the information sheet, I think it sounds like the nail fixation would actually be the one that I prefer to have out of the 2.
Right, okay. Well, if you took part in the study, you wouldn't actually get to choose which treatment option that you would have. We'd randomly allocate you to receive either treatment option, and that's purely so we can make it a fair test between the 2 treatments. So you'd have a 50-50% chance of receiving either the nail or the screw and plate fixation. Is that okay?
Right. It's just I felt that the nail fixation would possibly be a little bit stronger and help me get back on my feet quicker. So I obviously want to get back to work and pick up my skating again when I can.
Well, unfortunately, we don't know which treatment option would be quicker for you to get back on your feet, and that's what we're trying to find out. Both treatment options are good treatment options, but in the long term, we don't know which treatment option will be better.
Right.
And the rehabilitation will be exactly the same with both treatment options. It's likely to be using crutches for up to about 3 months after your injury, and then getting back to sort of roller skating and your hobbies, normally 6 to 12 months post-injury, and that's likely when you'd be back on your feet. And that would be the same for both treatment options that are available. Yeah.
Okay. If I were to take part in the study, would there be a lot of appointments for me to come into the hospital or paperwork to complete, anything that's sort of going to take my time up?
We do actually ask you some questions throughout the study, and that's purely so that we can understand how the patient is recovering. So we ask you those at baseline, how you were pre-injury, and then we ask you those again at 4 other time points throughout the study. So 6 weeks when you come in for your normal routine checkup, and then again at 3, 6 and 12 months. At 6 and 12 months you'll be coming in for your routine appointment with a consultant or clinician anyway, and we'd ask you those questions at those appointments. But the time point in which you wouldn't normally come into hospital is 3 months, so we'd send you that questionnaire in the post.
Okay.
So the questionnaires would probably take about 10 to 15 minutes to complete, and we'd be happy to fill that in and send it back in a free post envelope that we would provide. That'd be great.
Yeah, no, that sounds all right if you're making use of the appointments when I'm coming into the hospital anyway.
Yeah.
Yeah. I think it's something that I'd be quite happy to do actually. The options seem fairly similar, and I don't think I'd mind which one I'd receive, and it's not taking up too much of my time. Yeah, no, I think that'd be great.
Great, okay. Well, if you're happy to take part in the study, is that okay?
Yeah.
Great, we'll fill out the consent form and then we'll go through and do the questionnaire. Is that okay?
Yeah, that'd be fine.
Great.